A very good evening, students. Now the next bone is the scapula. Let us learn what are the common questions asked in the Viva on scapula. स्केपुला के ऊपर वाइवा में कौन कौन से इम्पॉर्टेंट क्वेश्चन पूछ सकता है एग्जामिनर, उसको हम पढ़ेंगे या देखेंगे. नाउ as soon as he asks you to pick up the scapula, you just pick up the scapula, try to determine its side. So you have to yourself ask the side determination, or he may ask. एग्जामिनर भी बोल सकता है कि ये राइट साइड की बोन है या आपके हाथ में जो बोन लेके आप खड़े हैं वो राइट साइड की है या लेफ्ट साइड की है. So you just determine the side, and if you could determine the right side, say correct side of this bone, then he will ask how you could determine the side. For example, this is the bone, and if I determine its side, then this belong to that of the right side. Let us see the other bone and see to which side it belong. Okay, both the bones, they are of the right side. So he will ask you how you could say that it is of the right side. Then you say that there is an inferior angle, this is inferior, this is superior, and this is the lateral angle. So the inferior angle should be directed downward, and this is the superior border between lateral angle and that of the superior angle, that is the superior, it should be upward. Okay, it should be upward. So just keep this upward and the inferior angle downward. Then you should say that the costal surface or the ventral or anterior surface of the scapula which shows the concavity, okay, it should be facing anteriorly, because you should differentiate this surface. You say him that the other surface is having a bony self-like projection from the surface, and this surface is the posterior surface, because this is the spinous process which is coming out from that of the posterior. So you have determined the ventral surface and say that it should be directed forward or anteriorly, and dorsal surface back should be directed backward, right? And then the glenoid cavity, you tell him that the glenoid cavity should be directed laterally, and the direction of the glenoid cavity, to which side it is directing, it will give you the side of the bone. So here the glenoid cavity is directing towards my right side, so this bone belongs to that of the right side. Okay, right side. If you will try to keep it in opposite direction, then the costal surface is backward and this dorsal surface is anteriorly. Always try to keep the bone, okay, as it is in your body. So if this is my bone, okay, then this belongs to that of the right side. In this way you can say him or her that this bone belongs to that of the right side, and these are the points on the basis of which I could say that this is of the right side. Then naturally the next question will be how to keep it in anatomical position. Just keep this bone in anatomical position, okay, and then you tell the points, okay, or he may ask the points, how you have determined its right anatomical position, and what are the factors on which, or the fact on which you can determine the side of, the correct anatomical position. Okay, you should say that the costal surface or the ventral surface which is concave, it should face, okay, anteromedially. Suppose this is the median plane here, my hand is towards, so it should face anteromedially. That means costal surface should not face directly anteriorly. There should be a tilt where the costal surface is facing anteromedially, and the glenoid cavity, it should face anterolaterally, not completely laterally, not completely anteriorly, but in between the anterior, that means between sagittal and coronal plane somewhere. It should face anterolaterally and slightly upward. So this will give you the correct anatomical position. Since the camera is on the top, I could not show you from anterior aspect, but I hope you have understood the 2 points for determination: costal surface anteromedially, glenoid cavity anterolaterally and slightly upward. Okay, he will be happy that you have answered his 2 questions very well, and then he will ask you what are the anatomical or bony features of this bone, and then you can say that this bony features, that the dorsal surface is having the spine, okay, and this is posterior surface, and because of this region it is because the spine is there on posterior surface, this is the dorsal surface, and there is no other process attached, which is concave surface is the ventral surface, okay, ventral. Okay, then he can ask you which is the medial border, then you can show that from superior angle to that of the inferior angle, this border which is thin, okay, is that of the medial border, to which the root of the spine is coming. See this is the root of the spine, that is the medial border. Then he may ask, show me or trace your finger onto the lateral border. Lateral border, you just trace the finger on this sharp margin extending from infraglenoid tubercle to the inferior border, from this infraglenoid tubercle, and it is sharp border, it is sharp. Don't confuse it with this bar like rounded ridge here, okay. This is not the lateral border. This border which is sharp extending here is the lateral border, so don't confuse. So you should clearly distinguish the inferior border from that of this bar like ridge of the bone which is on the costal surface, which is on the costal. Then he may ask you, show me the, put your finger in the spinoglenoid notch. So you just put your finger here in the spinum, which is between the glenoid cavity and the spinous process, okay, between the spinous process, right. He may also ask you, show me the different process arising from this bone. Then quickly you can say that from dorsal surface, this self-like projection is the spinous process, this one. And this one which is going lateral from this spinous process is the acromion process, that is second process. And the third process here which is beak-like, okay, and this is called as the coracoid process. This is, so there are 3 processes: acromion, spinous and coracoid process. I think this many important bony features he may ask you. Then he may ask you some of the attachment either on the spine, upper lip or lower lip of spine, on costal surface or supraspinous or on infra. But mostly they ask from one portion all different attachment. For example, he may ask what are the different attachment of the coracoid process. You can see that there is a common origin of the coracobrachialis and the short head of the bicep from the tip of the coracoid process. If the chalk he is giving you, you can draw it in the chalk, the pink color, because it indicates the origin. And then you can see on this surface of the coracoid process that there is the attachment, that means the insertion of the pectoralis minor muscle. So region of 2 muscle and insertion on 1 muscle. Then you should say that there the attachment of the 2 ligaments also here, and those are the conoid and trapezoid part of the coracoclavicular ligament. Conoid part is here and trapezoid part is onto the upper surface. So conoid and trapezoid are 2 important ligaments attached, and the third ligament extend between the coracoid process as well as from between the acromion process where I am putting my finger. So between the coracoid process and acromion process, this ligament which is here, it is the coracoacromial ligament, and it forms a socket below, okay, and that is called as coracoacromial arch, okay, arch. And in this socket which prevents the upward displacement of the humerus. Say for example, if it is humerus and I try to displace it upward, it will be stopped by this coracoacromial arch, okay, coracoacromial arch. Then he may ask, what are the nerves and vessels which are intimately related to this bone? This is the suprascapular cello notch, okay? And this gives passage to the suprascapular nerve and artery and vein. Now is here there is a ligament, suprascapular ligament, now passes deep to the ligament, artery and vein above it. So Navy is below and Air Force is above. That is the mnemonics which student they remember for relationship. Then you may say that there is a dorsal scapular nerve and artery which is close to the medial border, okay, and there is a circumflex scapular artery which just lies in relation to that of the lateral border. So these are the nerves and vessels which are in relation to that of the scapula, okay, scapula. I think I have covered almost all the points of the scapula for the Viva. But I will again say that you should first read about the bone and then watch this video on the important question on the Viva of the scapula, and this you may take as also a revision class, okay, as a revision class. Thank you very much for watching this video.